is Bernicia. I'll be your nurse today. I'm gonna wash my hands and close the door for privacy. Okay, can you start off by telling me your name and date of birth for me?
Kendall Casey, 072396.
Okay, and where are you right now?
I am in the hospital.
And what's today's date?
November 21st.
And what time is it?
8 o'clock.
And what brings you here today?
But I had to toe assessment.
Okay, and what that is just a physical. I'm gonna start at your head and work my way down to your toes, hence the name. Yeah, so you have any questions?
No.
Okay, so first I'm just going to, well, my patient is oriented to time, person, place, because she said her name, the date, and the time, so she's oriented. First I'm going to inspect her scalp and cranium. Just gonna look for any lesions, abnormalities. Her hair is thick and full. I don't see any abnormal lice or anything. So next I'm going to palpate her scalp. I don't feel any masses or anything. Again, hair is thick and full. Next I'm going to ask you to take your glasses off so I can test your eyes. Okay, so first I'm going to need you to stare at a distant object for me. Alright, keep looking at that object for me, please. Alright, next I want you to follow my hand with your eyes, keeping your head still for me, okay?
Okay.
Okay, my patient's pupils are perla, which are pupils are equal round reactive to light and accommodation. Her eyes follow the 6 cardinal signs. Next, I'm going to inspect your eyebrows, your eyelashes, both seem full, your eyelids. You can blink for me. Next, I'm going to inspect your ears. See if I see any masses or any abnormalities or lesions or anything. No. I'm gonna palpate your ears. Feel any tenderness or pain to your ears?
No.
Okay. Now tell me if you hear this.
Yes.
Okay.
Yes.
All right. And she can hear the finger rub test. Okay. Next, I'm going to palpate your lymph nodes. Okay, and your lymph nodes were not palpable, so this is a normal finding. Okay, next I'm going to check your nares for patency. Can you breathe it out for me? And again. Alright, so both of her nares are patent. Okay, next I want you to clench your teeth for me. Raise your eyebrows. Okay, next I want you to smile for me. Blow out your cheeks. Stick your tongue out. Alright, so her face is symmetric with those facial expressions. Next, I'm going to examine your mouth. So can you open up for me? Say ah. Alright, so her uvula is midline. Her oral mucosa is pink and moist. Her teeth are intact and they're straight, and I don't note any cavities or any ulcers or anything in her oral mucosa. Okay, next I am going to palpate your temporal pulses. Alright, they are both felt equal and bilateral. I'm going to next palpate your carotid one at a time. Alright, they are felt equal, her carotid pulses. So next I am going to assess your trachea. So can you swallow for me? Okay, her trachea is slightly movable and midline. Okay, so that's a normal finding. So next I'm going to assess for your jugular vein distension. So can you hold your head back for me? Okay, no jugular vein distension. Alright, perfect. Okay, so next I am going to Okay, I palpated your carotids. Next, I'm going to listen for a bruit over your carotid arteries, and I want you to hold your breath for me. I'm gonna listen with the bill. Okay, hold your breath for me. Okay, let it go. Hold your breath for me again. Alright, let it go. So I didn't hear any abnormal sounds when I listened to her listen for Bree. Um okay, next I am going to auscultate for long sounds. So can you sit up straight for me? Can you remove that for me, please? Okay, and I'm just going to auscultate her long sounds using the diaphragm of my stethoscope. So breathe normally for me. All right, so her long sounds were not no adventitious sounds in her lungs, and no wheezes, no crackles, or anything like that. So next, I'm going to auscultate for her heart sounds. This time, I'm going to use the bill and the diaphragm. So first, I'm going to do the bill, and I'm going to do 8 to man. Okay, so upon auscultation of heart sounds, I noted S1 and S2, and I didn't hear any murmurs or anything once I did it with the bill of my stethoscope. Okay, so next I'm going to auscultate her apical pulse for 1 full minute using the diaphragm. Okay, so her apical pulse was 70, which is in the normal range, and her while I was assessing for her apical pulse, I also assessed her respiratory rate, and it was 16, which is also in the normal range. Next, I want you to turn around so I can examine the posterior lung fields. Okay. Just going to assess her posterior lung fields using the diaphragm. Okay, sit up for me and take regular breaths. Okay, hold your arms out for me. I'm just going to assess the lateral lung fields. Okay, perfect. So upon auscultation, I didn't hear any wheezes, bronchi, crackles, or anything in her lung field. So now I'm just gonna palpate for tenderness or masses. Do you feel any pain or tenderness, Kendall?
No.
Okay, perfect, perfect. Okay, I want you to take a deep breath so I can check your expansion, chest expansion. Okay, and my thumbs move bilaterally. Okay, turn around for me. I'm going to measure your AP to L diameter, and what that is, your AP is going to be 1 and your L is going to be 2, and it is in line. Okay, so it lines up with the ratio. Okay, so now I'm going to assess your abdominal sounds. Can you lay back for me?
Yes.
And I'm going to pull your shirt up if that's okay.
Yes.
Are you feeling any pain in your abdominal area today?
No.
Okay, perfect. I'm going to lift your shirt up now.
Okay.
I'm going to start at the right upper quadrant and work my way around. First using the, I don't see any abnormal, her abdomen is symmetrical, and I don't see any abnormal findings, pulsations or anything. Okay, so first I'm going to auscultate her bowel sounds. I'm going to just warm this up for you. Okay, now with the bell. Okay, she had active bowel sounds in all 4 quadrants. I didn't hear any abnormal sounds once I auscultated using the bell. And again, are you any pain in your abdomen?
No.
Okay, so now I'm going to palpate. Any pain? Any pain?
No.
Okay, perfect. And I see that her ribs, the costal angles are at 90 degrees, and if I sit you up, I'm going to lift it up to note that the ribs, the costal angle is at a 45-degree angle as well. I'm sorry, can you lay down for me one more time?
Yes.
I'm sorry. Scoot back a little bit, please. All right, I'm going to assess for your Homan sign. So first, I'm going to and just relax for me. Do you feel any pain?
No.
Okay. Relax. Feel any pain?
No.
Okay. Perfect. Okay. You can sit up for me, Miss Kendall. Okay. So I'm going to assess your upper extremities for temperature. They seem to be the temperature seems to be normal and consistent over your extremities. No lesions or anything, no abnormal findings. I'm going to assess your radial pulse. All right, they are both bilateral. Next, I am going to assess your skin turgor. Okay, perfect. Now your capillary refill. Okay, less than 2 seconds. Perfect, perfect. Okay. I'm going to assess your lower extremities at this point. Okay, no. First, before that, I'm going to test your strength. So squeeze my hand for me. Okay, perfect. Your strength, your squeezing strength was symmetrical. You seem to squeeze both of my hands at the same felt the same. So now I'm going to assess your peripheral extremities. All right, I'm just going to pull your socks down. So I'm just going to feel for temperature, and they seem to be, temperature seems to be consistent. I'm going to take your shoes off. Okay. your socks off?
No.
Okay, so first I am going to, well, she has nail polish on. I would assess capillary refill on her toes too on both sides, but they were less than 2 seconds in her fingernails. So I'm going to assess her tibial pulse, equal and bilateral, and I'm going to assess her dorsalis pedis pulses. And they are equal and bilateral. Okay, next I'm going to test her lower extremities for peripheral sensation. So, alright, this is sharp and this is going to be dull. Okay, so what is this?
Sharp.
Close your eyes, please.
Sharp. Dull. Dull. Sharp.
Okay,
Dull. Sharp. Sharp. Dull.
okay. And I'm just going to see if you feel this.
Sharp.
Okay. Put your sock back on for me, Miss Kendall. Oh wait, I'm sorry. Take it off. I'm gonna assess your skin turgor in your lower extremities, and you do. It is intact. Sorry about that. Okay, stand up for me, please. All right, I'm gonna need you to I'm gonna do the Romberg's test and stand, feet together, eyes closed. Okay, so I didn't note any abnormal swaying or anything, so can you walk to that side of the room for me? All right, now walk back heel to toe for me, please. All right, perfect. Her gait was symmetric and steady. She didn't, she had normal swaying of the arms. Next, I want you to do range of motion, moves with me. So rotate your neck all the way around, side to side. Look this way, look that way. Okay, your arms now we're gonna test for range of motion. So hold your hand up, out, front of you, hyperextend it behind you, and do the same thing with the other arm. Side, behind you, in front of you. Okay, next do the same with your legs. So just to the side, back, front, move it in a circle. Okay, same thing with your other leg. Out, back, front, move it in a circle. Okay, throughout this whole assessment, my patient verbalized with me. She communicated with me well. She comprehended everything that I said. Her speech wasn't slurred or anything. She wasn't stumbling over her words, anything. So her speech and tone was intact. Can you sit down for me really quick? I forgot to assess one thing on your head. Can you look up for me? All right, her sclera is white and her conjunctiva is pink. And yeah, this concludes my head to toe assessment.